Jimin, one of BTS' most popular members, who is mostly known for his doll-like beauty. Over the years, Jimin's doll-like beauty have caught the eyes of many, some people even going as far as to get multiple plastic surgeries, in a poor attempt to look like him. But what a lot of people don't know, is that Jimin himself has undergone multiple surgical procedures to obtain his unique beauty. So in today's video, I am going to be discussing and analyzing all the surgical procedures I believe he has had over the years. The first and most obvious thing I think Jimin has gotten done is a nose job during BTS' earlier debut days. If you watch some of their interviews and pay close attention to Jimin's nose, you will see that he has a slight hump on his nose bridge. Along with a hump, his nose lays quite flat on his face and is a lot bigger and wider than it is today. We can see this clearly in some of his older pictures and videos. But, in recent years, we can see a quite difference in his nose. The hump on his nose bridge is no longer there. He now has a perfectly straight nose bridge, his dorsum is completely straight now, and his nasal base is a lot more narrowed. And his nasal tip looks a lot more refined. I believe he had gotten an allarplasty followed by a tip-plasty. A allarplasty can help you attain that by altering the width and shape of your nostrils with a minor incision to the sides of the ale. The ale are where your nostrils get rounded and reach to your cheeks. Followed by a tip-plasty, I do quite think they might have given him a silicone nasal implant to help achieve that perfect nose bridge. All in all, it's quite evident that he completely transformed and changed the shape and look of his nose. The next thing I believe he has gotten is a chin implant. A chin implant can help enhance a small or receding chin and add definition and contour to your lower face, profile and jawline. It increases the projection and length of your chin. This type of unnatural phenomenon does not occur due to weight loss. Weight loss does not increase the projection and length of your chin. We can see this clearly when Jimin attended a Dior fashion show. The projection of his chin implant is a lot more noticeable and present here. Along with a chin implant, I also believe he gets some Botox on his masseters to help slim his jawline. The next thing I believe he has gotten is some lip filler and a lip lift. Now, although Jimin's lips has always been on the much more fuller side, he has still experimented with some lip fillers over the years. But the most obvious thing he has done to his lips is a lip lift. A lip lift is an in-office surgical procedure that shortens the space between the nose and the top of the lip, known as the philtrum. The procedure increases the amount of pink tissue that's visible, which makes the lips look fuller and more pronounced. If we take a look at Jimin, it's quite clear that he has got this done. The length of his philtrum is a lot shorter and his upper lips looks a lot more fuller and flipped. So to recap, I believe Jimin has had an allarplasty, tip-plasty, silicone nasal implant, chin implant, masseter Botox, lip filler, and a lip lift. So the secret to Jimin's beauty is just a good plastic surgeon. So remember kids, you're not ugly, you're just broke.